Yeah, hi, this is Khalid Shebani. We'll demonstrate the laparoscopic cholecystectomy in a patient with severe metabolic syndrome, hypertension, micronodular cirrhosis, and non-alcoholic steatohepatitis. As you can see here, the cirrhotic liver. Now we place three trocars in the right upper quadrant area of the abdomen. Then we will retract the gallbladder towards the patient right shoulder. Now we are dividing some of the inflammatory adhesions between the right colon, the greater omentum, and the undersurface of the right lobe of the liver using the sonicision ultrasonic dissecting device. I'm using the bovic we're going to identify the triangle of Callot. The boundaries are depicted. And as you can see here, there is a great amount of fat around now the gallbladder that makes the cholecystectomy challenging on the morbidly obese patient. Now we are incising the peritoneum over the triangle of Callot and the gallbladder, and we are using a spreading motion to identify the tissue along the correct anatomical tissue planes. We don't use the stripping technique. Now we are slowly identifying the cystic duct, and as you can see here, a window is created between the cystic duct and the gallbladder. And also now in these cirrhotic patients, they tend to bleed more than the patient who do not have liver cirrhosis. Now we have just identified the connection between the neck of the gallbladder and the cystic duct. Now we're going to open the peritoneum over the cystic artery. Then we will divide the cystic artery using the sonicision ultrasonic dissecting device. Now we are clipping the cystic duct with two clips on the patient side, one clip on the specimen side. Now we're going to clamp down those clips so they don't come off. Now we're going to divide the cystic duct. Then we proceed with separating and removing the gallbladder off of the liver. And as you can see here, now the sonicision is controlling the bleeding very nicely. And here now we're using a combination of sharp and blunt dissection. And the gallbladder is very dilated, very distended. It's bigger than the usual size gallbladders. Again, it's very important here to notice that the bleeding is well controlled, especially on these cirrhotic patients. So that's a good advantage of using the ultrasonic dissector. Now we're going to take the gallbladder off completely of the liver. We're going to place it in a retrievable plastic bag. Then we're going to check for the bleeding control. looks like the hemostasis is secure. And this concludes our video. Thank you.